All right, David, thank you for joining today and welcome to the show. I'm glad to have you on and really dive into what you guys are doing today at the company.
Yeah, it's great to be here. Thanks for having me.
All right, perfect. So first, David, just as an opener, could you share a little bit about yourself, who you are, what the company does, and also who you guys serve as well?
Sure. So I'm David Norris. I'm the co-founder and CEO of Affinion Health, and Affinion provides an AI inbox for healthcare providers that helps them get through their inbox faster and saves a lot of time. My background is in technology, been in technology for a long time, have also built quite a few companies, so I'm a serial entrepreneur, and I love building great teams and tackling hard problems.
Mhm. What really inspired you to do what you're doing now in terms of, I would say, the AI inbox and providing that service?
So throughout my career, I've spent a lot of time using AI and primarily machine learning. And with some of the new advances in AI, I'm super excited about the impact that can have on various industries. I've spent a lot of time in healthcare, and I'd say I have a soft spot for helping doctors because I think they have almost an impossible job. They try to do a bunch of things. They try to keep us healthy on the one side so we don't get sick. On the other side, when we do get sick, they try to help us. And sometimes it's hard. They don't know what's wrong with us. And I really, really love the idea of leveraging all of the smart technology that we have out there to try to help doctors to really do a better job of caring for people. And I think if we can do anything with AI that's really, really good, it'd be helping to care for people. And that's why helping providers is my soft spot. So I love being able to do that.
Touching on to that. So from my understanding, I know Affinion is designed to help reduce time spent in lab and sort of patient communication. So could you share specifically how, or even an example of your technology transforming that workflow for healthcare providers?
Yeah, it's really interesting. I think with some of the latest in AI, there's a lot of capabilities. And
Mhm.
when you look at what a provider does, there's all kinds of providers, but let's talk about a PCP. So you go to your PCP for an annual health checkup, and what do? They check everything, and then they typically will order 4 or 5 different labs to check to make sure you're doing well.
Mhm.
And what happens is, the next day, the results from those tests come back into their inbox. And a typical PCP is seeing 20 patients a day. So if you ordered 5 labs, that's 100 results that just came into their inbox. And that happens every day. And on top of that, they're getting messages from patients like us asking them crazy questions like, what does this mean? And what should I do about that? And they're getting prescription renewal requests. They're getting a lot of stuff. So if you think your inbox is tough, you should see a provider's. It's much
Mhm.
worse. And so when you think about AI, the things that AI can do really well is it can understand a problem and it can digest very large volumes of data to try to answer that question. So with things like lab results that come back, we have built a solution that can take a set of lab results coming back. We can load all of the history for a patient, so everything that's ever happened for that patient, and we can analyze the lab results in the context of that patient's history. And that's really important because you might get lab results back for a patient, and let's say that they were a diabetic. Well, then you would do things slightly different than if they were not a diabetic. Or let's say a person's pregnant. Lab values can be quite different for a person. So our intelligence helps us to analyze the lab results, go back and compare it to prior lab results, suggest, we can create a smart summary for those set of labs, and we can suggest to the provider, hey, here's what you might think about doing next for this specific patient. And in our solution, it goes even as far as, and here's a message that you could send to the patient explaining what the lab results were and what we're going to do next. So you can actually do a lot of that work for them that they would otherwise have to do. Now, to be really, really important point, we believe in empowering the provider, not necessarily just doing it for them. So when it comes down to it, I think of their clinical expertise. They went to school for many, many years and they've trained and they've got all this experience. That clinical expertise is a very precious resource. And what we try to help them do is use that where it is best needed. And I think that is absolutely the key here. It's not that you don't want to get doctors involved. You want to get them involved where they need to be involved, and then they can really, really help. And
Hmm.
AI is a way to make that happen.
I can really relate to that because it's funny we're talking about this. I just got some blood work done. I saw my primary care doctor Monday, and I just got my results back. I think it was early this morning I checked, and I had to do my own research and realize, okay, what's this mean, and what does that mean, and what does that mean? So I can understand, from their perspective, all the hundreds of cases they see in that one day and the amount of lab results they have to go through. Like it can be a lot, and I completely understand, how your software can help with that issue as well.
Yeah, sometimes you might send them a question like, "What does this mean?" Right? You might
Yeah.
Google it, and that might scare you to death, and then
It,
you send
it
them a message, and that's part of the problem is that creates even
yeah.
more of a burden on the provider because they've got all these patients asking all these questions. What we've found is that if our software can analyze the lab results and then send a better, more explanatory note to the patient, kind of explaining it all, you're less likely to turn around and ask a question and bother your
Hmm.
doctor. So rather than if you send lab results to a patient and then you don't communicate with them, they're going to ask questions. It's reasonable. And that causes a lot of problems for the doctors. So I think it's better for providers to communicate more and better to the patients so that they don't feel fearful. They don't feel scared. They know what their doctor's telling them. And I think that's where AI can help. Doctors are super busy, and it's not that they don't want to communicate your lab results, but it's often that they're just too busy and it might take them a week. So in your case,
Hmm.
have you got your lab results, but did your doctor send you a note explaining your lab results to you yet?
Yeah, I actually got a note back, and she told me certain levels that she's like, on the fence about, want to retest in about 3 months' time. So I actually did get that back.
That's perfect. See, that's
Hmm.
that. Now, was that drafted by AI or was that really your doctor?
Hey, I don't know.
Well, that's part
Shit.
well that's part of what we do is we believe that empowering the provider and then having them review and then send to you that note is super important. I think the doctor needs to be in control because you don't want to be talking to some, AI and just hoping that it's right. You really want the provider to make sure it's right. And I think
Hmm.
that's the safe approach here. So that's what we've done is we empower the provider, but we always make sure that they're approving and then sending whatever it is. Because that at the end, it's their responsibility. It's not AI's responsibility to be right. It's the doctor's.
I completely agree. And moving on to, I know provider burnout is such a significant occurrence, especially in today's healthcare environment. Can you elaborate on your guys' solution and what are strategies are you kind of guys doing to help in that scenario as well?
Well, it's one of the things that I think is our biggest challenge. If you look at the industry today, if nothing changes by 2030, we will have a shortage of 200,000 doctors. And there's only 1 million doctors in the US, so that's 20%. And what that'll mean for all of us is you won't be able to get appointments. It'll be harder, it'll be more expensive, and you won't get as much care. And that's not good for anybody. So burnout is a huge problem because providers are critical to our health and our health system. And
Hmm.
so what we're doing to try to address that problem is take the things that they're having to spend time on today where they shouldn't and try to automate those or try to assist them so that we can reduce that amount of time where they're not really needing to spend their time. I'll give you an example. We
Hmm.
talk to a lot of providers that say there's a lot of stuff that comes into our inbox that we don't really need to spend time on. Can you just automate that? And we have in our product, we've created a way for a doctor to tell us, here are a set of labs that come in, and I don't need to spend a lot of time on these, but you should go ahead and process them. And they predefine a whole set of things that can be moved. The example would be if you go to the ER tomorrow and
Hmm.
you have some problem, the hospital is going to fax, believe it or not, fax
Oh,
lab
wow,
results
sadly.
from your ER visit, they're going to fax them over to your primary care doctor. And
Mhm.
it's not that your doctor can't do anything because you already went to the ER yesterday, but they're getting these faxed results. We can automatically route those to the staff. And so the provider doesn't need to spend time on it. And that's what they have to do today, but they do it manually and we can automate that. So we can remove a bunch of what noise from their inbox. So back to the burnout problem, if you can help just to remove those things that are just uselessly going to the provider and then focus the provider's time where they do need to spend it, you can help them in two ways. One, you can just save a bunch of their time. But two, you can also eliminate the frustration that you can imagine that they feel with having
Yeah.
to read a fax to just figure out that Shane went to the ER yesterday. And by the way, when you're in the ER having a problem, your lab values might be crazy because something's wrong. So the PCB can't do anything about that. So they don't, so they're just getting frustrated. So there's this two sides of it. One of them is they're staying up late at night trying to work the inbox. And the other is they're just getting frustrated. It's like, why am I getting all the stuff I don't need? And
Mm.
so I think if you can reduce both of those, you can reduce physician burnout because they're able to spend their time doing the thing that they went to school for, helping patients. That's what they
Yeah.
want to do.
Yeah, I completely agree. Like, do you think there should be any like cultural changes as well within healthcare organizations to help reduce the burnout? I feel like, if certain things don't change internally, then like you said, by 2030, that number is going to be a realistic number.
I think it's a really good point. I think as a society, we have to make sure that we put providers into the right positioning of how we view them and their role. And I think historically it's been a bit off. Like it's kind of like a car repair place. You don't really think about them until your car breaks. And then you take them to the car repair place and they fix it, right? And then
Mm.
you pay for it. And in healthcare, that's called fee for service, right? You go in, they fix it, and they're very happy to take your money because your
Oh
car's
yeah.
broken. But in healthcare, that's not the best way. Like we all know that if you were to eat right and exercise and take care of yourself, you could, in many, many cases, avoid getting sick. But the problem today is that we have positioned doctors as a car repair place, right? You just go there when you're sick. And
Mhm.
I'll give an example. So, how many times do you talk to your doctor when you don't need to?
Pretty rarely. Yeah.
Exactly. You don't just call your
Yeah.
doctor and go, "Hey, how you doing? Just haven't talked to you in a while." That doesn't
Yeah.
happen. And it doesn't happen the other way around. Also, your doctor doesn't go, "Hey, Shane, how you feeling?
Hmm.
It's been 6 months since I saw you. How are you doing?" But that's the way it should be. I mean, we really should, as a society, think about our physicians as not like sick care, but rather well care, right? They should try to keep
Yeah.
us healthy. And if you look at the stats for the United States, look at the obesity rates, look at the diabetes rates, we're causing providers to have a lot of work fixing the car because a lot of people are broken. And there's
Hmm.
so much we could do to prevent that. I think that's the one big change in healthcare. We call this kind of the shift to value-based care, where we're trying to keep people healthy rather than fix them when they're sick. I think that's the one thing that we should really focus on, trying to view our providers in a different light.
I completely agree. I feel like the value-based care shift now, it's essential. It's really something that us as a society, especially in the United States, people may have their viewpoints on our healthcare system, but it's not good. We have so many people being sick, and there's no real. It's more sick care, like you're saying, instead of preventative care. That's really the envisionment where we need to be headed. Do you think that? Let's say that there's hope for do you think eventually we're gonna get to that stage where okay, we're kind of switch this mentality in terms of actually preventing sickness instead of treating it?
Well, I think it's a pretty big topic, and there's a lot of work with a lot of companies that are
Hmm.
trying to enable value-based care. I think it's interesting, just the human behavior. Often people don't do what's right for them, and they know it.
Yeah.
They don't eat right, they smoke, they don't exercise. And then often there's something that occurs, like they have a heart attack. And all of a sudden they start eating really well and they start exercising because they don't want to have a second heart attack because it was pretty profound. And I think
Hmm.
that you can learn a lot from that. People sometimes don't do anything until they have to, but when
Hmm.
they have to, they do. And I think with our society, we need that step to occur where people really, really understand that it is not just nice to take care of yourself, but it's actually required. And that's what it's going to take if we're going to really make this shift occur. And today, that doesn't really exist. We've tried putting small financial incentives in place and other things, but those don't usually work. You need something a little bit stronger to motivate people.
I completely agree. And currently, David, as founder, how are you currently spending your days? What's a day in a day like for you?
Well, it changes as the company matures, but we started the company several years back and we built the product, and now a lot of our time is spent working with customers, rolling this out to thousands of providers,
Mhm.
where we have to figure out how to support different kinds of providers. In medicine, not all providers, they may be the same type, like they might all be PCPs, but they don't always practice medicine the same way. And so we're very busy tailoring our product to really address the needs of all different kinds of providers as we're exposed to different groups. And you would think, as an example, that if you got your blood work done by your PCP and then you went to a different kind of doctor, like in a woman's case, they go to an OB doctor because they're pregnant. There's a lot of differences between that. They may both order blood work, but what they do with it, why they order it, and then how they view it can be quite different. Our opportunity is to take the incredible power of a product that we've built that is so interesting and uses AI in such a great way to help doctors and fan that out to help more doctors. And I think that's the exciting part to me. We want to help everybody. As an example, we're introducing imaging in Q1, where we will not
Mm.
only be able to process her blood work, but image results that come back, like a mammogram or an X-ray or an ultrasound. And that's very important to a whole bunch of doctors that do a lot of those, like OB. So I think I think it's just an exciting time to help a very, very big number of doctors. And I spend a lot of time figuring out how we're going to scale to do that across, again, hundreds of thousands of doctors.
hmm And what are some of the challenges or bottlenecks you've encountered, let's say in the growth trajectory to get providers to understand, really what you can actually do for them?
It's tricky because providers are so busy.
Hmm
They're trying to run the treadmill every day of see a lot of patients and do all their inbox and do everything else. And then when they struggle often to adopt new technology because they're so busy. And that's a key area of where we spend time is working with large health systems to, especially their innovation groups or their medical groups, to help them understand how practical these kind of new technologies can be. A lot of people have a view of new technology like AI, like, oh, I'm
hmm
not sure about how hard that's going to be to adopt. And what we've tried to do is package it in a way that it's super simple. Our product typically takes a few hours to turn on, and then you can just use it. It's not something that takes weeks and weeks or months and months to integrate and do all of this. It's
hmm
actually really easy.
Oh, that's nice. Wow.
Yeah, and it just works. It's kind of like, you buy something, like you buy an iPhone and it just
Mhm.
works. You just use it. In our case, when we turn our solution on, it just immediately helps. And then what you'll see with providers is they smile. They're like, that's nice.
Yeah.
And
Like a sigh of relief.
exactly. And that's where you've hit the mark, because
Mm.
you don't want a product like, how many times do you read the user manual for an iPhone? Well, never.
Never.
Yeah. So with our products, it's the same thing. You just turn it on and providers are like, wow, that just works and it's nice and it's easy. And so I guess the theme there is to take these really advanced technologies that we're using in AI and then bring them down to a practical level where they just solve the problem. They're not hard to use. They don't take a user manual. It's just nice. And I think that's what is required to help these very large organizations adopt new technology.
David, as we approach end of 2024, we're counting on the days, right? And we're looking ahead to 2025. How would you reflect on the past year in terms of key milestones, challenges that shaped the business this year? What's your overall view of the year so far?
Well, I think I'll talk about the industry overall. I think
Hmm
2024 was a pivotal year for healthcare And one of the biggest sort of enablers that has come out is AI. And I think 2025 is going to be the year that AI becomes really, really practical and used at scale. 2024 was a lot of people experimenting and trying things and trying to learn like what could it do. But I think 2025 is going to be the pivotal year where it gets rolled out in volume and a lot of people start actually benefiting from it. ChatGPT came out, and from a consumer standpoint, we all play with it and use it for things.
Hmm.
But there haven't been a lot of what I'd call enterprise level solutions that have rolled out in volume to a lot of real businesses where it actually has to work. That's what's going to happen in 25. And that's what makes me super excited is by
Hmm.
the end of 2025, when we're doing this podcast next year and we're looking back on, hey, what happened in 2025? I think we're going to say we saw a lot of actual deployments of AI at scale, and it
Hmm.
really made a dent. We actually helped. And I think
Hmm.
that's what gets me super excited. 2024 was pivotal in enabling us to then do this, but
Yeah,
2025 is where it's actually going to happen.
I completely agree with that. I feel like this year we're definitely the guinea pigs. There was so much new and technology and innovation that came out this year. It's like kind of innovation overload, I guess you can say.
Exactly.
And yeah, it was just it's fascinating to see these technologies being deployed on that enterprise level and actually the change it can make on that scale. I'm excited.
Yeah, I think there was also a lot of investment that went into
Oh
early
yeah.
stage businesses in 24, and that set of investment activity that went on is now going to translate into a whole new set of capabilities and features and products. So 25 is going to be very exciting. And let's face it, from a healthcare side, I think we all want it to be better. And
Yeah.
all of this is eventually going to translate into features and capabilities that all of us will get to experience.
Hmm.
And that's kind of where the rubber hits the road, right? When you kind of go, wow, yeah, this is actually better. Or when your doctor calls you and let's say in the next 6 months, your doctor, hey Shane, how you feeling? How you doing?
Oh, like wow.
That
And my doctor messaged me.
that would be unusual. You'd probably fall out of your chair if they did that. My doctor called me for no reason. Imagine that. But AI is going to enable that.
Yeah, I can definitely see that. So, David, what advice would you give to other entrepreneurs looking to enter into the healthcare tech space, particularly in addressing provider challenges?
Well, there's a lot. A couple of things that come to my mind. I talk to a lot of entrepreneurs that maybe haven't been around the block as many times as I have. And
Mhm.
often they have very big ambitions. But in healthcare, one piece of advice I would give is that it can often be harder to take a concept and actually make it work at scale in an industry like healthcare than some other industries. It's pretty easy for two people in a garage to go take something like OpenAI and make something really, really cool as a demo,
Mhm.
but turning that into a production ready system that, for example, providers could use on a day-to-day basis reliably and have trust is
Yeah.
very different. So my advice would be don't underestimate the requirements to make something work in an industry where it can't work some of the time. It's really got to work all the time. That
Mhm.
is a bigger task than many, many companies realize at the beginning. And that means more time, more money, and it's hard. But one of the things that people don't realize, you ever use ChatGPT and ask it a question and have it give you a phenomenally great answer that's completely wrong?
That's happened before. Yeah.
Yeah. Well, it unfortunately it does happen, and they're called hallucinations, but it happens quite a lot. And you certainly don't want that happening with your doctor. If he's asking you, "Hey, what's wrong with
Yeah.
Shane?" and it's coming back with an answer that sounds very convincing, but is completely
Mhm.
wrong, I think that can undermine the trust that providers have in these kind of new technologies. And we've got to be real careful not to do that. Earning trust is hard, earning
Mhm.
it back is harder. So you don't
Yeah.
want to violate that trust. So I think that's the advice I would give is just be really careful not to lose that trust that you have with providers.
I see. And of course, do you think it will take time for the providers and other organizations in healthcare to kind of adopt those new technologies? For example, if an entrepreneur were to bring that and sort of say, hey, this can help with X, Y, and Z problem, do you think but just to be a time thing on their hands as well.
Well, yeah, I think it's challenging because providers are very smart and they're always excited about new technology and they're pretty open to trying stuff. If it then doesn't work and you lose their trust, I think they're going to be really skeptical about trying it again.
Yeah.
So I think that's the challenge here is you might get them to play with something, and if it's a good demo and it kind of works, you might get them real excited. And then when you actually roll it out and they have to use it day to day and they can't rely on it, it's going to be hard to get them to come back. So I do think that's a challenge. I love providers and they have a tough job and they have a limited amount of time to try stuff out. So it needs to work.
If you could influence one aspect in the healthcare system through your work currently, what would it be and why?
I think most of my long-term focus is around actually improving the health of patients. I've built quite a few businesses over the year, and I've always thought you can look at it from two sides. You can either
Mhm.
try to create a solution that helps people when they're sick and help them try to get well faster, better, and so on. Or on the other side, you could just try to help them never get sick. If you look at the overall impact you can have on healthcare, I'm convinced that you can have a bigger impact if you can prevent them from getting sick rather than trying to help them once they are sick. And once
Yeah.
somebody has diabetes, you can help them to treat diabetes, and you can even help them try to improve to the point where they don't have diabetes, but it's really hard. If on the other side, you just prevent them from getting it in the first place, you're so much further ahead. And I think as a country, I think that's probably the place where we can make the biggest impact. So that's what I would like to do. And I think providers want that also. Providers don't like having to see another patient that has diabetes and then they put them on a medicine and they're basically treating them for life. Most providers would much prefer that they're able to prevent that. And I think that's where this needs to go if we're going to make a real big impact on healthcare.
Are you going to come up with another company and solve that issue for us, David?
Well, I think Affinion is going to do a pretty good job of making a dent there. And so I think let's start with what we're doing now. I think, again, AI is a powerful thing, and it's still a little difficult to make it do everything we want it to do, but we've been able to do that. I think over the next 5 years, AI is going to get better and better, and it's going to reach a point where we can make some of these differences. So I think this can be an exciting time. I
Mhm.
couldn't be more excited, man, of the whole last 20 or 30 years in healthcare. This is by far the most exciting time. We have the biggest opportunity to make the biggest impact right now. And let's face it, that's about as good as it gets.
And last question here, on a personal level, what drives you to continue pursuing innovation in the healthcare space despite all the challenges that are out there and some that we mentioned today? What's that driver for you?
It's a really good question. For me personally, it's the result. It's being able to look at specific cases where patients were dramatically helped based on what
Mhm.
we did. There's nothing better than that. I mean, when you know you actually made a difference for a person, and in our case, we're doing it for thousands and thousands of patients, that's pretty fulfilling. You can spend your time doing anything. And I have built companies. I think it's funny. I reflect back on some companies I built and said, if that company didn't even exist, would it make any difference to anybody? And sometimes it's like, no, you made a lot of money, you created a very successful company, but nobody
Mhm.
cares.
Yeah,
And I think for me, if you look back on it and you go, we made a real difference and we really improved people's lives, that is meaningful. And that is why I do what I do. And there's nothing better than that.
perfect. Thank you so much, David, for your time and sharing your insights and, of course, what you guys are doing right now with the company and the whole vision for the next few years, 5 years to come. Thank you for what you're doing and sharing the story today.
Well, I'm happy to be here. It's really nice to spend some time with you, Shane. So thank you, and thanks for doing what you do and helping to share expertise from different people. It's really great. I mean, this is how we all get better, and so thank you.
Absolutely.